Today I want to give a brief overview of the most important system in the human body whenever it comes to hypertension. This is the system that will raise blood pressure. It's there as a safeguard to make sure as humans our blood pressure doesn't go too low, but obviously in competitive athletes and people who are more prone and due to diet and other factors, high blood pressure can also result as a problem from this very system. There are many prescription medications and they act on this very system, and I'll get more into the specifics of what exactly these medications do deeper in this video. So this system is known as the Renin Angiotensin Aldosterone System, also abbreviated as RAAS. This is a system that occurs systemically through the body. A couple of organs basically are responsible for releasing some enzymes or some of these peptides, but this is something that happens with everything in circulation running through your bloodstream. So I'm going to organize this into steps to paint a clearer picture for you to make sure everything is well laid out and just simplified as much as possible. So the very first step in this process is that angiotensinogen, which is a peptide, gets released into circulation by the liver. Now this peptide gets released whenever the body senses that there is a change in the concentration of sodium in the body, or if it senses that your blood pressure is going too low. This is the very first step that happens. So angiotensinogen circulating through the bloodstream, and then it meets renin, which is an enzyme in the kidneys. So renin is responsible for converting angiotensinogen into angiotensin I, which is an inactive peptide. So then we have angiotensin I circulating in the bloodstream again, and then whenever it passes through the lungs is when this major reaction takes place. In the lungs, we have a large amount of what is known as angiotensin converting enzyme, or otherwise abbreviated as ACE. You may find this name familiar from the term ACE inhibitors, which is a type of prescription blood pressure medication that is given to reduce blood pressure. So angiotensin I passes through the lungs. That's where it meets angiotensin converting enzyme, which then takes angiotensin I, converts it into now the active form of this peptide, which is known as angiotensin II. Angiotensin II is the vasoactive peptide that has the ability to act on receptors, which will then cause vasoconstriction, which then gives rise in the increase in blood pressure. Okay, so for step 3, we have angiotensin II, which is this vasoactive peptide, which is then able to increase blood pressure. So how it increases blood pressure is by binding to this receptor known as the angiotensin II receptor type 1. So once angiotensin II binds to this proper receptor, it then causes vasoconstriction. So vasoconstriction alone will cause an increase in blood pressure, and what also causes an increase in blood pressure is once angiotensin II binds to this receptor then causes a signal to the adrenal glands to produce more aldosterone. Aldosterone is a hormone that causes more sodium retention, which also decreases potassium and also causes water retention in the nephron of the kidney. And also on top of this, we have this angiotensin converting enzyme. Once there is more angiotensin converting enzyme present, this also reduces nitric oxide synthesis. So nitric oxide is a molecule in the body which causes vasodilation, which is the opposite of vasoconstriction. So you want more vasodilation if you have high blood pressure. It's going to widen the blood vessels, allow more blood to be pushed through, and that's in turn going to lower your blood pressure. This enzyme, angiotensin converting enzyme, reduces the amount of nitric oxide synthesis, which also leads to an increase in blood pressure.